Like a glimmer of hope with BC's earliest trajectories. Models now suggest that physical distancing has halved the spread of COVID. And here's the graph everyone is watching tonight. Now, because there's a 14-day incubation period, there's a 2-week lag in seeing those efforts kick in. The gray line would be with no measures taken in BC. The red line is where we're actually at now. So keep in mind, look at the arrow. It was mid-March when BC first started implementing measures. And you can see that gap starting to widen between where we would be and where we're at now with those measures. In the 2 weeks since those measures came into place, the climb of the new cases has slowed from 24% growth per day to about 12% now per day. And Dr. Bonnie Henry credits a few reasons for that.
One is our changing testing strategy, but also, driven by our physical distancing and the important thing that everybody is paying attention to that physical distancing, as well as the restrictions in travel. So that other group of people that were continuing to come into BC, having been exposed to this virus in other countries, that has also stopped, and that's made a difference in our trajectory as well.
Interesting models to look at, Tanya. What about hospital beds? Do the models suggest we have enough?
Yes, but where that bed capacity comes from depends on the situation. The province is breaking down 2 phases of hospital capacity. Primary sites, those are 17 biggest hospitals in the province, and secondary sites, those are 38 smaller hospitals and other facilities. Now, using those parameters, Health Minister Adrian Dix outlines BC's hospital capacity under 2 scenarios.
Using the likely scenario of below or at a Hubei epidemic level using ICU and high acuity unit bed capacity along with vent capacity, we are reasonably focused on being able to handle that within the 17 prime COVID-19 care sites. If we were to move to a Northern Italy trajectory, BC would have to use all sites to meet bed demand and implement increased transportation of patients between sites.
Now, Italy's hospital system was already full when the surge hit, overwhelming that healthcare system. But BC has had the luxury of advance warning to free up critical beds and resources like canceling those elective surgeries. Here's a slide looking at the hospital beds. Non-COVID patients may be moved around to free up acute care beds. Look on the right, you can see BC has proactively freed up more than 3,900 hospital beds by deferring non-essential surgeries. But you can see there we do have a deficit, at least in Northern Health, if beds aren't moved around.
All right, what about ventilators? Does our province have enough of those?
Same kind of thing. The province believes it should have enough ventilators to meet demand, even if it follows Italy's extreme pattern. Here's another graph. This chart assumes 80% of patients in ICU will need a ventilator. You can see the most populated areas of the province are better equipped for a bigger outbreak, with Northern Health seeing the fewest ventilators right now. But BC does have a total of more than 1,200 province-wide, with more on order. And so health officials are working with BC Ambulance on transportation plans to be able to move patients and equipment around the province as needed. Mike?
All right, Tanya Fletcher joining us live tonight. Thanks.